I'm Matt King. I'm an ICU physician here at Sumner Regional Medical Center. I've been managing coronavirus patients in the COVID ICU for the last 10 months. Here today to give you an update about Sumner Regional Medical Center and where we are in the pandemic. As of today, we have 56 COVID-19 patients in the hospital. That represents about 40% of our total hospitalized patients. And we're not alone. All the hospitals in the area are experiencing the same influx of COVID-19 patients. It's gotten to the point where we have difficulties transferring patients to other hospitals. We're receiving patients from hospitals that we typically do not receive patients from. For example, we've had patients from areas in Kentucky, from Lawrenceburg, Pulaski, Fayetteville. Those are areas that do not typically refer patients to this hospital. Our emergency room is currently housing about 10 inpatients. This is a very unusual situation for us. While we have had days in the past that have been similar to this, we have not ever experienced such a sustained high volume of acutely ill patients. I spent some time in New York working in the ICUs there in March and April, and this is the first time that I've become concerned that we're going to get to the situation that New York was in back then. We're up to 23.3% positivity rate. While some of the recent positive test numbers have looked encouraging, that's really just because we haven't been testing as much in the past few days related to the holidays. We're still concerned that we will see another wave on top of the current surge related to Christmas gatherings. We know from some of the Vanderbilt polls that as many as 50% of people in the area had no intention of changing their holiday plans, which makes us very concerned that there were large gatherings that could have been spreading coronavirus. That being said, the hospital has a great plan for accommodating more patients. It has been an exciting couple of weeks as the vaccine arrived, and we've been able to vaccinate all of our frontline health workers that desired vaccination. In terms of more general vaccination, we are optimistic that that will be available within the early spring based on what the state has told us. Going forward, we continue to encourage everyone to be safe and responsible with their COVID-19 precautions. Please use masks, please distance yourself, please avoid any gatherings that are unnecessary. As always, don't delay your emergency care. The ER here at Sumner Regional and at Sumner Station is here for you 24/7, 365.
We are recording whenever you are ready.
All right.
Introduce yourself.
All right. I'm Matt King. I'm an ICU physician here at Sumner Regional. I've been in the COVID ICU for the last 10 months managing coronavirus patients. And I'm here today to give you an update of where we are as a hospital at Sumner Regional Medical Center.
And you can just look at the camera when you're done with your statement, look down. That way we've got that clean break.
Okay. Instead of looking back and forth.
We don't want you looking down.
Okay.
So.
Do you want me to do another take or?
Sure.
Okay. I'm Matt King. I'm an ICU physician here at Sumner Regional Medical Center. I've been managing coronavirus patients in the COVID ICU for the last 10 months since the pandemic first started. Here today to give you an update about Sumner Regional Medical Center and where we are in the pandemic.
Very good. Yep. So now just look at the next statement. Come coaching, boss.
Hey, Jeff. Yeah. Nothing they could do to solve this problem.
Oh my goodness. So we're at 56 now.
Yeah.
He's about to say that. This is next one.
That's my next talking point, actually.
Okay. The things I said earlier, I think the painting a realistic picture